Dr. Witkowski, let's start with you. Dr. Witkowski is an OBGYN, and he has just been awarded as a fellow of the American College of Lifestyle Medicine, which you're one of the first to do that, which is pretty exceptional.
Yep.
We're so lucky to have you with us here, but can you tell us a little bit about your practice and why you chose Nutrimetrics?
Sure. Well, 2 years after my father died, I found his wallet. This is his wallet. You can see there's his Harvard ID card because he worked at Harvard University. You can see that he has his MasterCard still in here.
You just lost American Express.
And his Tufts Health card. But most importantly, when I opened his wallet, Marty, I found this piece of paper. And on this piece of paper, there was a list of medications that my father was taking. That list is 17 medications long. That hit me right between the eyes. Lantus, Indor, Cardizem, Lopressor, Simvastatin, Clonidine, Lasix, Plavix, Allopurinol, Elavil, Combivent, Tylenol he used to take, vitamin D, Ecotrin, Questrin. 17 long. "15 years before my father died, he had quintuple bypass surgery. If anyone doesn't know what that is, that's when they take an electric saw, they cut your sternum open it up, so that they can harvest a vein from your leg and go by the blocked blood vessels in your heart. 2 years before my father died, he had his leg amputated just below the knee from complications of diabetes, because he was a diabetic. The interesting thing is, none of his doctors asked my father about his lifestyle, asked him about nutrition, asked him about what his goals were in 15 years, 20 years when he had this done. And here I am. I'm the son of the doctor. I should know. I went to a great medical school, Tufts Medical School in Boston, Massachusetts, and in Tufts, we had one of the greatest, thank you, Boston. We had one of the greatest nutrition trainings. We had 21 hours of nutrition training in 4 years of medical school. And even through my residency, never talked about lifestyle. So with this, it was the perfect storm. My patients were asking me, why am I getting put on medications? My patients were gaining weight, and they were coming to me for answers, and I had nothing to give them. So it hit my family, it was hitting my patients, and I had to go on a journey. I had to find something else that I signed up for, because this isn't what I signed up for. I really wanted to make a difference. I wanted to help people. But it didn't make a difference what I was trained. So I dragged my wife, Pamela, all over the country. We went to all kinds of conferences. I didn't know if it was integrative medicine. I didn't know if it was functional medicine, alternative medicine. I didn't know what it was. But then I found lifestyle medicine in the American College of Lifestyle Medicine. And lifestyle medicine is where we use evidence-based lifestyle interventions so that we can prevent and even reverse or treat lifestyle problems. Chronic diseases that are killing over 85% of all Americans. Cardiovascular disease, diabetes, cancer, and obesity. Those four kill 85% of everybody in this country. Then a friend of mine sent a Nutrimetrics consultant to my office, Kathy Kaufman. I don't know if she's still here today, but Kathy Kaufman, a well-trained Nutrimetrics consultant, came to my office. But I didn't have time for her. I'm a busy obstetrician gynecologist. So I canceled, and she came back. And I canceled, and she came back. It was 4 appointments that I canceled on her, and she kept coming back. Her persistence was phenomenal. So I gave her the time, and I started to listen to her. And she started talking about custom wellness solutions and residual income. And my wife and I were like, yeah, I would love to have some residual income. It's something we're thinking about anyway. And so Kathy said, if you come along with our program, I can teach you these things. So I had 3 questions for her. I said, will you be able to train me on the ingredients? Because that was important to me as a doctor. I had to know what I was giving my patients. I couldn't just give them anything. I had to know. It was my responsibility. I asked her too, can I try them? And sure enough, she had something in her bag that she was able to give me, and I tried them, and I liked them. I thought they tasted great. And then I said to her, well, Kathy, is this one of those companies where you got to go to a lot of meetings, and then you got to go to these big, huge conventions with a lot of rah-rah? And Kathy said to me, like every good trained nutrimetrics consultant, she answered the question with a question. She said, do you like rah-rah? And I said, hell yeah, I love rah-rah. So you never know. You never know. Keep an open mind when you walk into the office, because you can't prejudge that doctor. He might be busy, but keep going after him, because you're, just like JR says, you can't say the wrong thing to the right person. And that's what I would do. And then, as I went to some of the trainings, and I can tell you I went to 7 trainings for Nutrimetrics to learn about their products and learn about their ingredients, I really found this company fit very well into what lifestyle medicine is all about helping prevent and even help conditions that everybody in this country is dying from, like my father, and like a lot of patients of mine. So I don't think there's a better time right now with the push, with the wave of lifestyle medicine now sweeping across the country. Yes, it started in California and Portland, Oregon, but it's also coming east to Boston. And I see it every single day. More and more doctors are more interested now in helping prevent these chronic diseases, because we're starting to understand that's where medicine is. That's where we should be treating patients. Thank you.